36-year-old Dickson Njoroge was admitted at Kenyatta Hospital last week to undergo kidney transplant months after experts recommended the procedure.
Nilianza shida ya kidney last year, April 21st. I came here, they diagnosed me with kidney failure, and they told me that the only option is dialysis or transplant.
Dickson opted for a transplant after months of dialysis, a treatment option which he says was not only expensive but also disruptive to his day-to-day life.
When you start dialysis, you have to go 4-hour session 2 times a week. Saa zingine unaenda inakataa, catheter ina block. Unajua sasa catheter bado, it is expensive to put a catheter.
Cost of transplant medications is by far cheaper compared to dialysis.
A team of experts who conducted the transplant on Dickson Njoroge applied a first-of-a-kind technique known as laparoscopic surgery. This minimally invasive technique leads to faster recovery times for patients.
A while ago, we were making big incisions in the abdomen to get the kidney out, surgically, and transplant it. Over the past few weeks, we have joined the world whereby we do very minimal surgery. It's called laparoscopic surgery. We make very, very small incisions on the donor to get the kidney.
By so doing, you minimize scarring the patient. You're also able to minimize blood loss and therefore also pain.
Kidney dialysis costs 76,000 shillings monthly, and while this bill is footed by the NHIF, many are rendered jobless due to absenteeism at work at least twice a week. A transplant, on the other hand, costs about 200,000 shillings for investigations on the donor and the recipient before transplant, and 600,000 shillings for the surgery on the donor and the recipient. This too is covered by the NHIF.
The burden is the cost of medicine. The medicine is very expensive.
Unfortunately, NHIF, which is now been replaced by the SHIF, is concerned, they have not been covering the cost of the medications post-transplant.
Dr. Charles Waihenya, a lecturer at the University of Nairobi, stresses the importance of early detection and treatment of kidney diseases.
We should be having this, we should make it a routine that after every 4-6 months, we should be going for some medical exam to make sure that we are okay health-wise.
Kidney specialists advocate for the adoption of the organ and tissue transplant bill. This legislation is hoped to expand Kenya's organ donor pool, ultimately reducing waiting times for recipients and improving access to life-saving treatments. Ben Kerera, K24, Nairobi.